Okay, we're just getting started on the left knee. We're looking in the medial compartment to try and identify this tear. Well, we've identified the tear. That part's not the hard part. We want to see if we can figure out a way to save as much of this as possible. The poster horn way back here looks pretty good. This is almost completely torn through right here. So if we were to resect that, that would still leave that. You might do better if we just take off this inner edge piece that doesn't really have any vascularity here, and then we repair what's left. We're going to have a look at this in a little bit more detail. The good news is the articular surfaces look great. The cartilage looks fine. Basket. Okay, so we've taken away the flap. We're still left with this tear. There's a little bit of delamination to it. See that? And I don't really want to take that down. If I can avoid it, I'd like to save that, which would mean putting in a stitch here and maybe a stitch over there. We'll show you some more in a little bit. Hold on. Okay, we've got 2 implants in. The inner edge still looks a little bit rough, but if I chew any more or resect any more of that meniscus, we're going to be left with no meniscus right there. I'm trying to save that. And so I think I'm going to stop there. We're going to take a 25 gauge spinal needle and put our PRP in back there. And then the rest of that will go into the joint. So while we're getting that organized, I'm going to look in the lateral compartment here just to be sure that we've looked everywhere. And this lateral compartment looks pretty good, as we expected it to. We'll pull up and look at the patella and remove any loose pieces of cartilage. But as we pull back here and look at the patella, that looks great too. So exactly what we expected. We're just going through the meniscus into the meniscocapsular junction here. And we're going to place a little PRP here. This, we don't have to turn the water off because we're going into the soft tissue here. And we're actually injecting right now. You can see how it doesn't come out into the joint. We'll slowly start to back up. Okay, and then we're going to do this in 1 or 2 more places, and then the rest of it will go intra-articular. So this will be the end of the videotape. I really hope this does the trick for you. I'm injecting in the meniscus right now. If you look closely, you can actually see it start to plump up. Okay, now we're going to work back here a little bit. Bye-bye now.